Happy Sunday from my playroom / workout room / workroom. I'm working on a couple of PowerPoint presentations for the Lifeguard Halo Symposium, which is coming up in the next couple weeks. If you haven't seen it in my stories, don't worry, I'll post it again for you. Something that'll have lots of really good information and lots of different options for consideration, sort of for a paramedic, but really for all provider audiences, aimed at helping with health disparities and things like we have here in New Mexico as a poor, big state. And one of the questions I get a lot, especially from providers from elsewhere, is why do we have so much flight in New Mexico? Why don't we use more ground transport? One of the things about that is the sheer distance, right? We have large area to cover. It's, 3+ hour drive to several of our other little metropolitan areas, like Roswell or Cruces or Taos. And the other aspect of that is actually just like logistics of the transport itself. For example, when we go to Taos, if we take our fixed wing or our small plane, we're going to take the only ambulance in the entire county out of service in order to come pick us up and take us to the hospital, because we need that stretcher, right? You need that gurney in order to be able to take the patient. And so it's really important to have that as an option. So that's another consideration, and why I would say we take rotor or the helicopter up there to be able to land on the actual hospital more frequently. So it's something that there's a lot of different reasons for those decisions, and the speed is great as far as especially if you're worried about delivery soon. But it's also something that you have to really consider as far as resources and different aspects as well.